I'm going to present my abstract on improving utilization of multidisciplinary skills lab in Kenya. And like we had in the morning in the WHO presentation, we have 57 countries that have been severely affected by shortage of healthcare professionals, and Kenya is one of them. So the response by the Kenyan government, what it did was to rapidly increase the intake of students training to be health professionals. But even if they increased the intake of students training to be health professionals, there was no corresponding increase in the faculty numbers or the supporting clinical capacity at the teaching hospitals. So this discrepancy resulted in reduced individual student contact time with patients, and this has created a lot of challenges in ensuring that the graduates are competent in their clinical and procedural skills. So what the university did to address this gap is that it developed a skills lab. And our skills lab is called Multidisciplinary Skills Lab. So the University of Nairobi College of Health Sciences is the biggest, is the leading health professional trainer in Kenya, and it's made of 5 schools. We have the School of Medicine, the School of Nursing, School of Dental Sciences, School of Pharmacy, and School of Public Health. So with support from funds from MEPI, we've just had a presentation about MEPI here. So University of Nairobi is one of the beneficiaries. So with support from funds from MEPI, the university created the skills lab, the multidisciplinary skills lab, by merging several underutilized discipline-specific skills labs. So what happens is that before, we still used to have some skills labs, but they were not so much utilized. So with MEPI, we were able to merge all these skills labs, the skills lab at dental school, the skills lab at School of Medicine, the skills lab at School of Nursing, to be one multidisciplinary skills lab. And we had a coordinating committee made of faculty representatives from each of these schools. So the MEPI fund also supported by increasing the simulation and management resources. So we had a lot of simulation resources being bought. Then this coordinating committee, this faculty that were drawn from each school, they developed an action plan. They came up with an action plan to make sure that the skills lab was adequately addressing the needs of the College of Health Sciences. In addition, the committee also embarked on an accreditation process. So we started a process to have the skills lab accredited by an international body called the Society for Simulation in Healthcare. This is based in the United States of America, and it accredits simulation programs all over the world. So we got accreditation standards from this Society for Simulation, and these standards were very useful in guiding us on how to develop the skills lab, on how to make sure that we ensure quality, the management of the skills lab, how to make sure that utilization is proper. Then we also had some strategies for increasing the utilization, and these included training of faculty on simulation teaching. So it was no use having all these simulators without having people who know how to use them. So the other strategy was now to teach faculty on how to use these simulators. So we had some faculty being trained, and then we had open house days for students and faculty where they had a time to come to the skills lab, look at all the simulators that are there, how to use them. And we also had developed some promotional materials, some brochures about the skills lab. And also we really promoted the use of the skills lab during grant rounds. So to get our data, we use daily attendance registers and student evaluation forms. So each time the students come to the skills lab, they fill in their names, they fill in what they're coming to do, they fill in what simulators they're going to use. And also at the end of the clinical rotation, they fill in a student evaluation form where they evaluate themselves. How was the simulation experience? How did you gain any, was it beneficial to you? What areas did you improve on? So these are the tools that we used to get our data. And the results were that within 1 year of establishing the skills lab, we had utilization increasing from 8 students. So the first month, we didn't even have any students coming in. The second month, we had 8 students only. But after we implemented our strategies, we had the utilization increasing from 8 students, an average of 8 students per month, to 450 students per month. So right now, it's even much more than 450 students per month. So, and the biggest utilizer is the School of Medicine. So the picture there is just some, these are postgraduate students from the School of Medicine using the skills lab. Then utilization was also most notable when the skills lab was incorporated into the curricula as part of teaching or student assessment. So those schools or those departments that incorporated the simulation training into the curricula, the students from those departments were really utilizing the skills lab. For example, these are faculty from the School of Nursing demonstrating using a simulator, a high fidelity simulator in the skills lab. Then in the first year of implementation, again, we had 25 faculty being trained on how to use the simulators in clinical teaching. And we had some schools and departments began using the skills lab for formal student assessments. For example, using the OSCEs, Objective Structured Clinical Exam. Then from the student evaluation forms, the forms that were filled by the students to show, for them to evaluate how the simulation experience was for them. This showed that most students found the skills lab improved their skills performance and self-confidence. So most of the students reported that them coming to the skills lab before going to the clinical area, that really helped in improving their skills and also being very confident, even when they later went to the wards and did the skills on real patients. Then the accreditation process has really helped us because it highlighted areas of deficiency. So at first we were just starting the skills lab blindly, not having any guidelines. But when we were given this, the accreditation, the standards, the criteria that we must meet, these standards, they really helped us highlight our areas of deficiency and give us a guide on how to reach a higher standard for the skills lab. And thank you. That's the end of my presentation.
Let's give a hand for Susan Mata.